Hair loss is a lot more complicated than what you think. I was just going to come in here and make a quick video on our kind of hair loss protocols and treatments that we offer, and I was running it by Addison, and she quickly informed me that it was a lot more to what I was expecting to say. So I brought her in today to just give us a little bit more in-depth approach and explanations on hair loss treatments, why we do this over that, and overall expectations. And if you want to make sure that you keep your hair, stay till the end so that you can hear all the tips for the best maintenance along the way. So part of the services we offer, 1, aesthetics, and 2, medical dermatology. We get hair maintenance and also getting more hair, head hair come up a lot. And this is more complex than what I was giving it credit for to begin with, because I was just saying, well, we'll just do Nutrafol and this, and then you're expanded on it. So I really wanted to expand that to everybody on just the various things. So say somebody contacts us and wants a hair consult. What do you look for and where do you start with that?
Yeah, so I would definitely say that when addressing hair loss in general, meeting with a professional is going to be the best bet, because hair loss is largely based on the history of what's causing it. So to dive into hair loss a little bit more complexly, it's broken into 2 categories: scarring alopecia and non-scarring alopecia. So the scarring alopecias are going to be much more complex and in-depth with progressive, permanent, non-reversible hair loss, which shows in a tight, shiny scalp or skin that does not have visible hair follicles. If that is the case, and if that's what anybody is saying, they need to meet with a dermatologist as soon as possible. We need to do biopsies, blood work. We need to put them on something oral systemic to not necessarily regrow the hair, because you can't regrow it once it's scarred, but preserve their hair. So we're not really going to address that today, because that's much more dermatologically complex. But today, and what most people fall under, is going to be the non-scarring alopecia category. And so when it comes to non-scarring, meaning the hair follicle is present, the hair is still capable of regrowing. You can still lose hair, but it's capable of reversing. So a couple of different types: androgenetic alopecia, which is typically a male pattern baldness, female pattern baldness, happens typically later in life, just genetically. That's what you were sort of past. Alopecia areata, which is when you find round, bald patches, typically induced after something really stressful, a death in the family, a cancer diagnosis, high stress. Anagen effluvium, which is chemo-induced, which is going to be a little bit more obvious. I would say 90% of people are in the telogen effluvium category, which is another type of stress-related, which can be anywhere from mild to severe, 8-month progressive hair loss from an event. Again, lost a job, a move, a pregnancy, postpartum, anything like that, where you can have mild to severe hair shedding for a continuous 8-month time frame. That's what most people kind of fall under. But we kind of got to get a little bit of a history, so I typically start with a medical history. Have you been started on any new medications? Are you on a steroid or a GLP-1? Have you had a recent major surgery? Do you have a new cancer diagnosis? Do you have an autoimmune disorder? Getting a history, medical history, surgical history, and new medications is big. Then diving into a social history. Are they recently divorced? Did they recently move? It was, again, a death in the family, a job change, something that can seemingly be internally stressful for us as humans. So that is a big part of sort of trying to pinpoint, not only for cause, but for timeline. Was this something that happened 6 months ago? You might be at the end of, an 8-month hair loss process. It just gives you an idea or a timeline. And then in certain situations, an exam. There are a couple things we can do in dermatology to assess. We always look at the scalp. Is there redness? Is there flaking? Is there inflammation? Is there scarring present? We can take biopsies, which can actually give you concrete, yes, you have telogen effluvium, or hey, you have a scarring one. We need to treat this differently. Lab work sometimes is needed. Again, most people are in the telogen effluvium category, so doing labs is not always super effective unless we're having a really hard time pinpointing this. We've been on stuff for a year or longer, it's not working, and we need to troubleshoot deeper. I mean, we can do it, but it's not typically always super helpful. But labs would include things like vitamin D, thyroid, and ANA. You know, do they have an autoimmune disorder? A CBC, an ESR, not, you know, super effective, but DHEA, those things where we would just say, hey, is there an obvious iron? Iron studies are really helpful. Again, most women we're finding with the hormones are deficient in some area of iron. So sometimes doing labs right off the bat can be helpful, not always. Once we have done the history and done an exam and kind of pinpointed what type from the non-scarrings, then we go into, okay, what do we do about it? What we like to emphasize is this is going to be a continuous process. Most people want quick, fast, good results, and hair loss and just regrowing hair does not work like that. It is a slow process, and it just takes some time. So, I mean, there's...
And so, like, we get people calling all the time, you know, on the GLP-1 specifically saying, like, hey, is this medication causing my hair to fall out?
I would say what we typically do, which is coaching. You know, if you're with a good practice and they're doing their job at coaching you on exercise and protein, I would say that unless they are one of the few, you know, telogen effluvium typically is a 20 to 30% hair loss temporarily. If they're one of the few where it's like a 90% hair loss, I would say stop it, because that just the stress of that is going to be more jarring than the weight loss. But most people, I would say, it's going to be temporary. Let's get them on something that's going to be supplemental. So approaching it, you want to prevent from further shed and regrow at the same time. And so I would say just putting them on that, making sure they know how important their protein is and how this typically happens as a result of, you know, if they've lost a lot of weight in a short period of time, or if they're not really getting enough nutrients, it can happen. But it doesn't happen in everyone, and if it does happen, there's little things they can do to tweak it. So only discontinuing if it's one of those rare, severe cases.
But typically just kind of like assessing, make sure it's like, okay, make sure you're not eating 500-600 calories.
Yes.
Getting your protein in. And then I've typically recommended checking thyroid and iron just to make sure those are vitamin D. We find a lot of vitamin D deficiency. If they're not on vitamin D, almost everybody
Iron
is.
deficiency, yeah.
And then, you know, and then just reassuring the body can pick up that significant weight loss as the stressor.
Yes.
And so it's not necessarily the medication itself, but we need to make sure the building blocks are there so we're not.
Right. And so you can lose up to 100 hairs a day. That is a normal expectation. And so sometimes people hear, oh, these meds can cause weight loss. They're a little bit more aware of it, but only when you see a drastic increase in that hair loss. You know, it's coming out in chunks. You know, you're seeing patches gone. You know, you're seeing tons on your pillow or in your brush that was different from how it was before. I mean, we're going to lose a lot of hair a day, but it's when it gets up into those much, much higher numbers. There's something called a pull test that we do in dermatology where you can grab some of the hair and do like a gentle pull. And depending on how many hairs you get, it can either confirm or deny telogen effluvium. But in general, when it comes to the GLP-1s, it's really just about really making sure that their nutrition is solid and the quantity. You know, if they're more stressed out about, and this is the other thing, hair loss tends to be a reoccurring cycle for people. If you're one of those people where it's really going to affect you, stressing out about it, doing something and not seeing results increases your stress, which is really just working against reducing your stress for hair growth. You know, so having the expectation and the knowledge that it takes time and consistency for most of the interventions to actually show fruition. So a year later, if you're not seeing benefit, okay, we can be worried and amp up your routine. But 2, 3, 4 months later, most of the time you're not going to see anything substantial.
So let's kind of talk about all this stuff around it. But stair step, what is your approach to hair loss and treatment? Just say somebody's looking to optimize. Their hair is thinning. We haven't, you know, it's not the scarring alopecia. What is kind of your stair step in offering them treatment for their hair thinning?
Yeah, so I would say my baseline is going to be natural supplemental type things. So Nutrafol is one of the, it's becoming more common. It's sort of like a multivitamin for hair growth specifically. Everything in it is geared towards hair growth. So collagen, vitamin D, biotin, ashwagandha, saw palmetto. It's just got a bunch of different things in it, all to promote and specifically target stress and inflammation. On the other hand, another very common oral supplement for hair growth is Viviscal. Viviscal is going to gear more towards preserving the hair that you have, but has some of the same stuff, vitamin C, biotin. It does have apple extract in it. Nutrafol specifically shows signs of decreased shedding by the 3rd month, but most improvement in hair thickening by 6 to 8 months. Viviscal, on the other hand, has some improvement in lack of shedding and hair growth in a 3 to 6 month time frame. So again, if you've been taking it a month and you've shown no benefit, that's normal. We wouldn't expect to, So Viviscal and Nutrafol, I would say, choose one. You don't need to be on both. A lot of people are like so panicked they just want to do everything under the sun. I wouldn't say that that's necessary. They are a little bit similar. So one or the other of those, I think Nutrafol, I think study-wise, we're seeing a little bit more benefit with. Topical Minoxidil like Rogaine. A lot of people are kind of scared of Rogaine because myths about, it works when you use it, but when you stop, you lose all the hair that you grew. And that's a myth. That's not true. It works while you use it. And when you stop using it, it stops working, So that's kind of the thing about Minoxidil, but it works to regrow your hair. So with a supplement, you're preventing further loss and trying to regrow. With the topical Minoxidil, I think it's 5%. You're regrowing. So the combination of the two and then time on both is probably what I have most people on. Minoxidil comes in a foam. It's over the counter. You can get it at most places. It's not expensive. It comes in a foam and a liquid, and it is something you're applying directly to your scalp. You've got to be careful because if you put it in other areas, you can have hair grow in other areas. Women have to be careful not to get it in unwanted areas.
Can guys use it for a beard?
Technically, yeah.
Okay.
Yeah, we don't do lots of oral minoxidil. I mean, again, it has been done. There are just higher risks for cardiac issues. When you're weighing risk and benefits, when you're addressing something like hair loss, which can seemingly be minor, it is a big deal to a lot of people, but the risks don't always outweigh the benefits when it comes to oral.
Yeah, I've offered it to a couple people, and again, they're most concerned about it.
Yeah.
And whenever I was looking into it, it seems these lower doses don't have kind of the scary risks very often, but they are, their EKG changes, pericardial effusion. I mean, that sounds terrible, but at the same time, if they are a little hypertensive, it was made as
and we don't get lots of those negatives. So it's just something the patient has to be aware of. Mm-hmm. If it's somebody who is losing sleep and they are very, very affected by their hair loss, it's worth it as long as they're aware of those possible risks. Finasteride, we've kind of talked about a little bit. I sometimes will put that in a topical compounding cream. There's a couple of compounding pharmacies that have alopecia creams, and they have 5 different things in them. And it might be topical, like a low dose topical finasteride, minoxidil, a tretinoin that increases hair by increasing the cell turnover, so it's making you produce hair quicker, and sometimes a gentle steroid, which is just going to target inflammation that could worsen it. So the combination of those 4 and just a topical with a good Nutrafol is a great approach for hair loss.
Yeah, I still hate even topical finasteride.
Yes. So we talked about finasteride. In an oral form, it can, one, block testosterone turning into DHT, and then it can also have a large risk of sexual side effects, specifically for men. I don't know that it has the same in women.
I'm not sure either. I think maybe the underlying reason of why a lot of guys ended up with me initially, because the doctors were giving it so readily, like, take this and it's going to protect your prostate, to even young guys. And hymns, they do it pretty frequently. Yes. Protect your prostate, keep your hair, don't worry about anything. And then now they start having erectile dysfunction or erectile difficulties, poor libido, and they don't realize because it was not conveyed to them that that's a thing. So I typically don't like it. I typically will stop it and really work on these other things.
Yeah.
I've used topical ketoconazole, like 2%. It's supposed to block the androgenic in the scalp. I don't know if I gave it 6 to 8 months for a lot of people. I just didn't get tons of results.
Yeah, it's going to be, if you're going to get benefit, it's going to be mild. It's technically an antifungal medication, but it can work mildly. Sometimes steroids too, it's not necessarily comfortable, and that's why most people don't do it, but you can inject steroids into the scalp. For example, alopecia areata, where they have patches, one of the consistent treatments we do is every 4 to 6 weeks we inject the entire bald patch with a Kenalog. It lowers the inflammation and allows the hair to regrow, and we get great results. Obviously they're on supplements as well, but that's going to be a little bit more of the procedural type extreme approach. Also PRP, we offer PRP. PRP is platelet-rich plasma, which is essentially drawing your blood, spitting it out, and then pulling out just the platelet-rich plasma, which is going to essentially amplify and improve where it is put in the joint, and improves the joint function and hair. It increases hair on your face with microneedling. It increases collagen and elastin, and it can just be really helpful. We don't have tons of studies on exactly how helpful in hair. For microneedling, it increases collagen by 400%. So we have people that do this once a month for a few months, and we've had a patient who had great results from it. So yeah, that's another aggressive, can be a little bit pricey, but also is going to be more aggressive, so it can have more benefits. So
anecdotally, I've seen a lot, but I don't have a huge sample size, and they've done really good. And I mean, truthfully, I'm pairing it with other things. Yes. I'm trying to hit them with multiple other things. So the PRP specifically, yeah, I think it works, but I also think it works synergistically with these other things.
Yes, so that is a big thing with hair losses. There isn't one thing you should do. There's 5 things you should do. It's multifactorial as far as attacking the different causes, but also promoting and preventing. And so typically most people are on multiple things. We're not just on one. And if you're going to do one, I would say just one of the supplements, but just the time and the time frame that it takes for things to actually work. Minoxidil doesn't necessarily take a long time to work. That is going to give you a more sort of visual improvement quicker, but it's not going to do anything to promote further loss. It's just going to regrow, So they all sort of attack their own thing, but yes, typically multiple things is the way I would address it.
This is just a, curveball question that I just thought of, but does dermatology have anything for like preventing gray hairs? I've seen a couple functional med things that I'll say.
No.
Like from a
functional medicine.
I've seen super high dose melatonin and
preventing gray hair.
Kind of from an antioxidant standpoint.
Yeah, I mean, it makes sense.
Aside from just getting it dyed, I didn't know there was
like
any.
The oxidative stress. Yeah. That would be a great thing to study, though. Like if functional medicine can figure something out.
Does minoxidil do that directly or anything that you're aware of?
Not that I'm aware of, no. I know that minoxidil is not, like it makes your hair kind of feel maybe a little crunchy a little bit. But again, once you shampoo it out, most people don't have any issues. But
a couple of the guys that I've been doing PRP on, again, I'm doing multiple stuff, their hair's darker and they seem to have less.
I would have to look that up. I don't know an exact answer on that, but it's interesting. And so I know that after anagen effluvium, a lot of people that have lost hair and their hair will grow back either a different color or a different texture. I had a friend who had red, straight hair and she had cancer, lost it. It came back like a brown, super curly, And so I don't know the full science behind that, but that would be interesting to know, because if that happened and somebody wasn't aware that was a possibility, that could be a little jarring. If you have blonde hair and you all of a sudden now have dark brown hair, you know. But I'd have to look into that. That's interesting.
The last thing, that's something I say almost every day, is like testosterone replacement in guys does not cause hair loss unless they're genetically prone. Right. Like they are worried that if I start testosterone that my hair is going to fall out and I'm going to go bald. We don't really see that, especially with testosterone replacement doses. Right. If you're just doing testosterone, you're not doing crazy high, supraphysiologic, multiple anabolic compounds, those guys probably have an increased risk of normal. But normal testosterone replacement, I don't see it unless it's genetically prone. They're going to lose their hair no matter they're on testosterone or not. Maybe it accelerates a little bit, but I haven't really seen too much.
And some of the guys are already bald and they're like, I don't care at all, And if it's something where, I typically will say, if this is something that could concern you, go ahead and start Nutrafol. You can go ahead and start Rogaine. But I haven't had a lot of guys actually complain about that, so.
No, and my kind of last thing, Hail Mary that if you need to keep your hair, like it's part of you, I tell the guys, I mean, going to Turkey and getting a hair transplant
Yes.
is not like terribly expensive in Turkey specifically because they do it a lot, and it's like
I didn't know
don't
they were like a big.
Yeah, Turkey
pinnacle for it.
specifically, as far as I know, it's $5,000-$6,000,
Yeah,
which
I
in the
know.
U.S. is going to be a lot more.
It is going to be more expensive. I used to work at a university setting, and they were always doing hair transplants, which work really well. There is some downtime, but it is one of the surefire ways. Again, if your hair is sort of part of you and your identity, they take hair follicles from different areas and literally plug them into where you're losing the hair. And after things heal, sometimes you don't even know. You have hair growing where it wasn't growing before. There's minimal scarring. Just some downtime. Initially, you have some swelling and stuff where it's obvious, but a lot of people with bandana or a hat during that downtime, and then you've got permanent hair growth.
Switching from non-DHT sensitive areas to DHT sensitive,
Yes.
like that's kind of how it works, right? Like these aren't
Yes.
in a male pattern baldness. Back here is not sensitive to androgens. And so you move those up here.
Yes.
And I've also seen it is, like you do want to go to somebody who has been doing it a lot because it's essentially like growing a lawn. Like they pick your hairline and everything.
100%, yeah. So the sort of side peaks in the front of the forehead area and sort of the center is where most men, as far as male pattern baldness, are going to lose. Female pattern baldness is typically just that center crown area. So that would be sort of last resort or first line, depending on how crucial keeping your hair is. But that would be the most aggressive way of approaching it. And I've seen great results with it.
What else? Is there anything else?
I would just say that there are a couple other medications more systemically, again, for the more severe cases where you may have 90% hair loss, whether that be from telogen effluvium or alopecia areata. Again, it's going to be in combination with consulting a dermatologist, but there is a medication called Latiflu out, which I've prescribed a few times for people that is newly FDA approved for alopecia areata for regrowing hair, even in pediatrics. When you have a 10-year-old who's lost 80% of their hair, that's going to be very jarring, very upsetting. So there are a couple medications out there. Aside from that, there are autoimmune medications that can help attack the immune area that's causing the hair loss. It's going to be extreme and rare, but there are options out there. So what I would say really is we've got to determine what type it is, but most of the time it's going to be in consult with a dermatologist.
And I'd say kind of the biggest thing apart from, managing it from a clinic, from a provider, is setting expectations.
Yes.
That this is not a 1 month fix. This is an ongoing thing and something that we'll continue to monitor, hit it multiple sides, and I think that would...
Yes, and then forget about it. Have your plan, have your diagnosis, and then stop stressing about it, because what happens is people are like looking at their watch and looking at their hair, and whether it's 2, 3, 4, 5 months, they start to sort of obsess a little bit, and that's when that cycle starts where they're just not seeing the results because they're so focused on it. So I would say get your diagnosis, get your plan, do it, and then sort of forget about it, reassess in a year, unless you're having a severe hair loss, So the expectation needs to be set up front. It is a long process. The journey of telogen effluvium is 8 months, so we would never expect free. And you may have benefit at 3 or 4 months, but the expectation is not to really anticipate that.
Okay. All right. Well, I think that's it. Thanks for coming in.
Yeah.